Hi, good morning Sebastiano. My name is Allison Newman. I'm your invigilator for the OET speaking session on the 23rd of July 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Sebastiano Martiz.
And what is your candidate number, please?
My candidate number is 2320927.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are your thoughts about nurses going on strike?
I know there are many instances when nurses and other healthcare professionals choose to go on strike, but I'm not sure I agree with it. I know, I'm just beginning my journey to becoming a successful nurse. Becoming a nurse is to care for patients. I feel like when nurses go on strike, it puts patients and other healthcare providers at risk.
Can you give me an example of a situation in nursing when you would need to implement critical thinking skills?
I think all aspects of nursing must require strong decision-making. One example of critical thinking I can think of is when a nurse checks vital signs on a patient whose condition seems to suddenly change. By doing this, the nurse can determine what actions to take next and will have data to give to the doctor when she reports the changes.
How do you establish rapport with people from different cultural backgrounds?
I think the first step in building rapport with any patient, especially patients from different backgrounds, is to be approachable. If I were assigned a patient from a different culture, I would approach them with a smile and a friendly attitude. I would speak in simple terms and avoid slang, as I know these are easily misunderstood. If the patient seems confused or anxious by my presence, I will try to find out if they have any family and include them in any conversations. Also, if the client speaks a different language, I will ask my supervisor about translator services within the facility. Moreover, I will try to reduce anxiety and calm the patient, which would be beneficial in building rapport and helping improve their outcomes.
What do you think the main reason is for people choosing not to seek medical care?
Although I'm sure there are several reasons people may forego medical treatment, I believe one of the main reasons is the lack of healthcare coverage. Although there are programs that offer reduced-cost medical coverage, individuals with lower fixed incomes and unemployed people often cannot afford even reduced premiums.
What role do you think nurse practitioners can play in helping reduce health disparities?
I believe nurse practitioners can significantly reduce health disparities in underserved populations. Nurse practitioners can provide almost every service a physician provides, but their services cost less, making the prospect of getting quality care seem more achievable.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Allison Newman. I am one of the registered nurses in this department. For confirmation, are you Clement McField's bystander?
Yes, nurse, I am his friend.
Thank you for your confirmation. For our better conversation, may I know your name, please?
My name is Sebastiano Martins.
Well, Sebastiano, may I know your relationship with Clement McField?
I am his colleague.
Great, so I believe that you are one of the best people who can explain to me about his accident. Isn't it?
Yes, nurse. I know about the accident.
That's fine. For therapeutic purpose, could you please brief me about his accident?
Definitely, nurse. In the industry, we both work in the most wet areas of the industry. Today, while carrying weight, he accidentally slips and falls. And nurse, I am really concerned about my friend's health.
I really understand how hard the situation might be for you. But there's nothing to worry about. Your friend is in the safest hands of our specialist doctors. Surely, they can help him to recover from this accident.
All right. But nurse, still I am shivering, as I cannot recover from the shock. Because I was witnessing his accident. And I was helpless, nurse.
I am really sorry for you, Sebastiano. I can realize your emotions. At this point, what I can provide you is counseling support to recover from the shock you are in now. How does that sound?
Yes, nurse, if it can help me to recover from the shock, then it's fine.
Thank you for accepting my suggestion. I will arrange the counselor soon.
All right, nurse, you may please. Well, I would like to know about the next steps in his treatment procedures.
Definitely, I am glad to explain the next steps of treatment for your friend. In Italy, he will undergo a series of investigations to find the fracture and its extent. Once it is confirmed, he may have a blood test to confirm his blood group for blood transfusion. Moreover, if he requires any surgery to correct the fractures, we will schedule accordingly. After the surgery, he will be kept in the hospital for a few days until he regains his strength and recovers back to his baseline.
Okay, I understand your words. So nurse, I think there is nothing to be serious. Isn't it?
Your thoughts are understandable. However, I am sorry to say that I'm not the authoritative person to talk about that. Perhaps, I can assure you that there is nothing to worry about his health status as of now.
All right, I got it. Anyways, that is good to hear.
Sebastiano, if you don't mind, can you answer my few questions regarding your friend?
Sure, why not? I will answer your questions to the best of my knowledge.
Thank you for your willingness. Could you please give me some information about his general health?
Generally he is well, and is not under any medications. He take care of his health very much.
I am really happy to know that. Meanwhile, have you informed his family about the accident?
Actually not. His wife is pregnant, and I am totally confused how to inform this bad news.
All right. I realize the situation. Well, is there anyone else in his family to inform this?
Yes, he has an elder brother who lives in the other part of the city.
That's fine. Actually, it is our responsibility and hospital policy to inform the patient's relatives about the patient's condition. So, if you don't mind, can you please share their contact details?
Of course. I will share his contact details. Well, nurse, I hope he is safe.
Yes, Sebastiano, he is safe. Your situation is sensible. Try not to worry. We are doing our best for him and your friend is safe with us. Please be relaxed.
All right, nurse. And how long will it take to give us an exact picture of his health status?
It won't take much time. I can collect all the details from the doctor once the assessments are done and test results are evaluated. Thereafter, I can give you a clear idea about his health status. Are you okay with that?
All right, nurse. Thank you.
Thank you for giving relevant information and listening to my words. I wish your friend a speedy recovery.
Thank you. That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.